We're live with that story.
Well, how was
Yeah.
that this morning?
I had to do life this morning, which is hard these days because as you are, I'm also in the world of startup mode, which just means like all I do is work. And I had to renew my driver's license, and so I was having a situation, and I have been saying for weeks that I need to cry because I have not grieved Rona appropriately. And you, I think, can probably relate to this when you get into the modes of like, I had this speaking thing and then this event and then this and this and this, and you kind of have to keep it together. Like sometimes you have to trigger that. Long story short, on my way home, Rona's favorite song was Driver's License by Olivia Rodrigo. On my way home from the DMV, it came on, and it like started the floodgates, which is awesome, as it should do.
Yeah.
But also like, I felt a little weird as a 40 something person just crying to teen songs this morning. So it's it's been a weird start to the day. That's all I'll say.
Oh.
Yeah,
Well,
that's
I
fine.
cry all the time in Target to Bob Marley, so I can identify with your story. That funny enough, it did happen to me the other day. I was actually traveling for work and yeah, traveling for work and wound up a hearing Bob Marley, Three Little Birds in the Target. And I just stood near the fitting rooms and the poor ladies were really confused because they were like, "Do you need help with anything?" And I was like, "Nope, just want to sit here and listen to the music." As I'm bawling, right? Just crying. Um,
That's so good because then you ruin someone's day. So you also don't want to tell them why you're crying. It's a conundrum that we're in.
yeah. So,
Now that people know the songs that make us cry, should we introduce ourselves and who we are? Feels like the appropriate next
yeah,
step.
we should. Because I feel like, yeah, we already got vulnerable.
Yeah, we did.
So yeah, why don't you go first, Lindsay? Tell us about who you are and why we are chatting this morning, drinking coffee publicly.
Okay. Um, so I think some folks know I'm Lindsay, obviously. I have worked in patient recruitment, patient engagement, and research for a very long time. About 10 years into that work, my daughter was diagnosed with a rare disease, and I was working in cell and gene therapy at the time, and she needed a cell therapy trial. It was her only option. So I ended up being Rona's donor, and I was in 4 clinical trials with her. I donated 4 times.
Hmm.
Um, and the experience of actually going through a trial, of actually living through that process and experiencing it and seeing what is involved in that. And obviously, ours was a really extreme case because it involved transplant, so very like hands on, profoundly shaped the way that I do my work now, and it has reshaped how I approach the work that I do. And for me, I think once you're a caregiver, there are things that you cannot unsee, and therefore there are things that you cannot unknow, and it changes how you approach the world. So we were introduced, and I will let you introduce yourself and your story. We were introduced through a mutual friend, and instantly was like, oh, this is one of my people. So really excited to be here with you today.
Yeah, oh my gosh. Well, the pleasure is truly all mine. I'm so grateful to have a chance to talk to you. And also just like for the opportunity for us to share the things that maybe like the nit and gritty and ugly parts of what we had to experience because we have such a unique perspective. I too, almost in like an eerie way, have a story that mirrors yours, which I think is just like so remarkable that we were able to connect in real life too. Um, that I was working for a healthcare technology start healthcare technology companies for 10 years and had been the founder of the HITSM community, which was really popular on Twitter for that decade of 2010s to 2020. And so it kind of catalyzed that community and then, had lots of other people certainly run and carry the baton there. But that experience as a communications person in healthcare too, I had talked about patient engagement and patient experience and the empowered patient and e-patients. And I think Blue Button Initiative was one big hot topic for a while and even got in the weeds a little bit on like reputation management and community management when it came to helping physicians and their own reputations publicly. And so I'd done all of those things professionally and similar to you, about ten years into my career, my second son, who was born full term, no complications, all healthy as far as I could tell, was diagnosed with an aggressive form of brain cancer at 5.5 months old. So we got thrown into a world that I maybe had had some exposure to just from the sidelines. But I didn't really know it. And I didn't really know it. Definitely I didn't know it until I was in it. And then once I was in it, it occurred to me how drastically different healthcare is experienced versus how it's operationalized as professionals, how we think about it as a public and as a society. There's such a disconnect there. And I think that's really maybe our common thread today, even and our intent with this is just having a conversation, reflecting on the journey and the experiences that we've had over that time and the lessons learned, including the grief and the end of life conversations and some of those harder, uncomfortable ones that I think maybe will draw some folks into the dialogue as well with us. Um, as professionals in this space too, and people that have not just built their career in it and then experienced it, but actually reoriented our careers too as a result of that experience into something more and more dynamic than it ever was. I think either of us maybe had imagined it would be. Let
Yeah,
alone,
that's
nonprofit founding life and like scaling nonprofits while also maintaining a career and self-care and grieving and all of those things wrapped up in there too.
grieving when Olivia Rodrigo comes on the drive home from the DMV. No, I think I 100% agree with what you said, and I think two things really struck me going through this because I I think the life pre-diagnosis, right? Would have thought my daughter's diagnosed with something, I'm going to throw myself into finding a cure.
Yeah.
It turns out there are really smart people already doing that.
Yeah.
There are people who are working on it. And so I took two things away from the experience. Well, many, many things. But two things and key learnings, which is one, the healthcare system's not working for anyone right now. It doesn't work for providers. It doesn't work for families. Like, they are just as burnt out and frustrated as we as patients and caregivers are. And the
Yeah.
second piece of it is that not everyone will make it. And death is a doorway we all have to walk through. And I think you get more comfortable with that concept after you lose a child because I'm going to go deep fast, but there's that concept of longing and child loss where you're not afraid of dying per se because you get to be with your kid again potentially. And like, so you live life with this confidence that you've lived probably the worst thing that you ever will. And then you are less afraid of things that are terrifying from before.
Yeah.
And so understanding that is a natural process and a natural step and the thing that has to happen in life for all of us. And how can we ensure that our days, no matter how many or how few relatively that we get, are filled with life? And how can we do that in a care setting? And how do we make it be about the humans that are living with the diagnosis instead of the labeled patient?
Totally. I have long, like after going through, and I guess we are going deep right away, after going through the end of life journey, I have become a huge advocate for palliative care and hospice.
Absolutely. Yes.
Not just as a discipline, but I actually see it as like the future of healthcare. It's like really the kind of specialty and practice of medicine that I think we actually all want and expect out of healthcare delivery across any other specialty. Because it's literally designed as a practice around how do we preserve decision making? How do we retain dignity as much as possible for the patient as well as the family surrounding them, especially pediatric hospice, right? Pediatric hospice and palliative care. And the unique thing with children too, which our viewers may or may not be familiar with, but there's some legal differences between pediatric hospice and versus traditional adult hospice. And that's that pediatric, you actually are federally required to be able to at least offer the opportunity for concurrent treatment. So you can place a child on hospice services and be eligible for hospice services and continue treatment simultaneously. Those things are allowed in pediatric populations. And so I think pediatric hospice actually in a lot of ways provides such a great window for where we can go as an industry around this like outcomes-based care model that's still comfort oriented. Because it's not just about forfeiting your strategy. It's actually incredibly more strategic than I think anybody would really understand until you're in it and having to live it.
Yeah, and there are so many studies that have shown that engaging with palliative care not only reduces things like stress and anxiety and trauma, because June is PTSD Awareness Month. I've got my post drafted, don't you worry. But like anyone who's lived in a hospital has PTSD. It's
Mhm.
true. It's
Yeah,
true.
totally.
And it has been demonstrated to extend life, the length of life. And
Yeah,
for me, like that's one thing that I don't think people understand. You do not put your child, especially in palliative care or hospice, unless you know where things are headed.
yeah,
I do think, actually, let me correct that statement. Rewind. You don't put your child in hospice unless you know where things are headed. Palliative care is something that any child with a critical illness should have access to. And in theory, they do, except that there aren't enough practitioners and it's not services that are covered. And also, there's the fear, right? There's the
yeah,
fear of if I say this word to the parents, are they going to assume things are in a place where maybe they're not quite there yet? But if I say it, are they going to assume they are? And
yeah.
how's the reaction going to be? Um, and it is such a game changer, and it helps you make decisions in a way that you said the word dignity, 100% respect for self gives a little bit of autonomy and control in a situation where everyone else is otherwise completely lacking in those two things. I think the world and healthcare in general, but the world would be better if we all took some lessons from the palliative care providers and focused on quality of life.
I could not agree more. That was a good mic drop. Mic drop statement right out of the gate. No, it's fantastic. I hope we have some palliative care folks listening in too. And if you do, we love you. We think you're
Yeah.
great.
I'm going out for wine with our team in a couple of weeks. We still hang
That's
out.
amazing.
Yeah, it's
That's amazing.
Stockholm. It's like Stockholm syndrome. Like I love that team so much, and I
Yeah.
like. I feel the most calm when I go to the hospital, which is also really weird.
Yeah.
But it's just for me, that's what works. But it's different for everyone. I know.
I went back to the hospital for the first time. It might have been last week. Actually, it was last week to the main hospital that we spent a lot of our time at. I went back for the first time since August passed away because it's not been quite a year yet. And I was there. I had this wonderful opportunity to participate in an innovation day that the hospital was hosting.
It's amazing.
And it was my first time back. And like, funny enough, actually, when I arrived, I had brought a big donation from August Artists to give to the hospital. And so I was connecting with Child Life. And then, like, the first folks I texted were the hospice team. I said, "Hey, I'm here. Any chance you're on site today?" And the first person I saw was someone on our team. The physician we worked with, unfortunately, she actually left like within a month of August passing away. And so
Yeah.
she moved to Boston. I did get to visit with her and her husband actually when I was visiting in Boston
That's great.
late last fall. So I'm sure we'll stay in touch and kind of continue the conversation that way. But at least being able to see that team was awesome. I have had a different experience though. So the only other facility I had been to there's two hospitals at Children's in Dallas that you can go to. And we live further north in the suburbs. So we typically will go to their Plano campus for anything that would have been like lower acuity and we could just get home faster. Of course, if we needed like the neuro team and like the neuro onc team, we had to go to Dallas. And so that was a little more complicated. But whenever we could go to Plano, we would try to go there. And I had went to a caregiver retreat event in the fall of last year at the Plano campus. And I will tell you that experience was really hard because I
Mm-hmm.
hadn't been back to any facility since he passed away at that point. And I walked into that building and I was like, no, I'm totally cool. This is great. And they were holding the event in a side conference area, conference room, and it was awesome. Um, but I walked in and like my brain was calm, but my body was not at all. And it's probably one of the more intense kind of PTSD moments that I had had in terms of my nervous system just overriding the logic. And it said, doesn't matter, your body does not feel safe in this environment. And I
Mm-hmm.
started like physically shaking. And I'm
Yeah.
so grateful I was there for a caregiver retreat because as soon as I walked in, they were doing a sound bowl bath thing
So nice.
experience. And so it was perfect timing to have that, like, all right, let's, support you
Calm
in
you
this
down.
journey and like come down from the threat level of it. But it's like such an interesting experience, I guess, just across the board, going back to those places that were so poignant and
Yeah.
can be triggering in a lot of different ways, whether it's a song or if it's, the dance studio or if it's the hospital facility itself. As a caregiver, especially, you wind up so entrenched in those emotional moments and you're likely in survival mode that all of these things are imprinted in your brain as kind of threats to some extent. And that's so hard to reorient from once you're on the other side.
Yeah, I think for me, the thing I struggle with the most, and maybe you can really, and maybe you can't actually. We'll see. This might be a single child loss situation, but I struggle going anywhere where there will be parents who are proud of their children, like the look of pride, like
Yeah.
a concert or graduation or a play or a sporting event. It's like this emotion that I think is so unique to parents. Then that's the one that I struggle with the most.
I struggle with that too, especially with kids that are about my son's age.
Yeah, yeah.
Um, I noticed that a lot. Actually, I had the same experience right after we got diagnosed too. I would see other, healthy toddlers or healthy babies, and I was always so frustrated because I was like, logically, I knew I was coming from, it wasn't like immaturity, right? It's just
Yeah.
this gritty emotional state. And you see these other children and you're like, I am so happy for them in one way. Like I hope they know how grateful they should feel for those circumstances. And that's a judgment on my part, like that may or
Yeah.
may not be fair. But it's so tough to see sometimes when you see that. Because then you're like, oh my gosh, my daughter, my son would have been that age or would be looking like that now, but they're dealing with this other thing. And there's so much grief involved with that. And grief isn't just loss. I mean, I guess it is loss, but it's not just the physical, like someone passes away loss. Grief is like, I lost this expectation that I thought I had, or this anticipation that I had, or this, flexibility and autonomy I had over my life. Like I'm grieving that, or I'm grieving what I thought was a healthy child, or I'm grieving what I thought was parenthood. And it's just so much heavier than I think. It's almost like love, right? Like I guess grief and love are so similar in a lot of ways because they're so dynamic, like more than any other emotion I've experienced.
Yeah. Well, I didn't write this, but isn't the saying like grief is the cost of love, right? Like you.
I haven't heard that, but I
Yeah.
feel
I
like
didn't.
it's
I didn't write it.
beautiful.
I should have taken credit since you hadn't heard that before. You would have thought I was like so profound. It would be great.
Oh my
Um,
gosh.
I agree though,
Um,
and sorry. Go ahead.
no, no, you by all means.
I was just gonna say, like, I think it's one of those things that we don't talk about a lot in this, but every person is grieving someone likely, and if you aren't, like, good on you. You will be one day. Sorry to break that news to you. Um, and it's so interesting to me, like working in healthcare. You work in the healthcare adjacent settings, both of us, right? Where we don't bring our whole selves to work, and yet if we did, I think the outcomes would be so much better because, like I say this all the time, patient is a gown we will all wear one day. You've likely been a patient at some point. We all have at some point, but
Uh-huh.
we will all go through that doorway of death, and therefore we'll have a journey where some part of our body fails in some way or another. And yet we build programs and we build systems and we treat things as if we won't also be on the receiving end of the care and the systems that we are designing. And to me, that's the most mind-blowing, most mind-blowing thing.
Well, and it's so tied to fear, right? And when I
Yeah.
think about one of the big takeaways I've had, and I've shared this on a couple panels that I've spoken on as well, maybe some podcasts, but the big takeaway I had following my caregiving journey was one, like my own understanding about my own nervous system and like understanding PTSD as a clinical function, but also just like PTSD effectively is nervous system dysfunction. It's like it's wired to certain things and triggers, and like you have to navigate that, and your nervous system is going to respond to certain threats or supposed threats in different ways or similar ways, predictable ways, actually.
Yeah.
But the big takeaway I had was that everybody engaging with healthcare, to your point, like the clinical teams too, doctors, nurses, therapists, child life specialists, social workers, all the different people that are involved with delivering care, everyone is a human being. And every single person has a nervous system, whether they're a patient or not, they all have their own nervous systems. And each of those people engaging with the work they're doing or the system and how it's delivering care to them if they're on the receiving end, every single person's engaging with the system likely in a state of fight or flight. More often than not,
Yeah.
everybody's coming from the space of fear. And it's that sympathetic nervous system activation that's so common in PTSD. So we're just hyper aware of it. But everyone's doing that. And we make this assumption, I think, in like institution of healthcare, that everyone's engaging with healthcare from a state of safety because they should feel safe, right? Everyone
Yeah.
should feel calm. But our bodies physiologically operate differently. They don't
Hmm.
function the same way when they're feeling safe and secure versus hypervigilant. And so we've made all these assumptions about how everyone's engaging, and it's not a difference in communication. It's not a different, like you could communicate literally the exact same thing, but it's received differently because of the receiver's nervous system
Yeah.
state.
Yeah.
And I think that assumption we've made as an industry that everyone's feeling safe and secure is just misplaced. And I think it's also a huge testament to all the work that we have been doing, either could work better if we create safety, or alternatively, we design for nervous systems that are in a hypervigilant state and we can actually engage more meaningfully people in those moments. So, but like that's this connection that I feel like we're missing as an industry across the board, whether it's clinical trial engagement or if it's patient experience in the
Yeah.
hospital itself, if it's just getting a patient to sign up for an appointment, that's an executive function that's impaired when somebody is afraid. And so it's not a matter of or inadequacy on the patient's side of not being able to like go and click the appointment. Like their brain physiologically is like, nope, I can't do that. And it seems illogical if you're in a state of safety. Like it
Yeah.
doesn't compute.
Yeah, that's such a good point. I think communication in general is something that we could and should likely be doing better. And when I think about, when you were talking, I was thinking about, and I'm not going to name names, so I'm going to try to blind this as much as humanly possible. But one of Rona's key team members, providers, kept disappearing whenever things went wrong. And I was so angry as the parent because I was like,
Yep.
we interviewed so many providers, and whenever like an infection pops up or her counts disappear again or whatever, you disappear. And I learned last year, so about 2 years after she died, that that specific provider had lost a similarly aged to Rona nephew or niece the year before Rona's treatment. And then all of a sudden it made sense because it's like, of course you're disappearing. You're
Yeah.
disappearing because this is hard and this is triggering you in a way. Whenever I speak to med schools or providers, I will go into detail that I will not go into detail here because, frankly, the average person doesn't need that on their conscience. They don't need to understand what we live through.
Yeah.
When I go through the topic of informed consent, when I talk about when we're communicating to parents, I'll go through the stress that we were under, and it's just this like 2 minute long list of things that we were dealing with and the lack of sleep and all of that, and then saying, and you're trying to consent me when I'm under that level of stress. It doesn't matter that I have an MPH. It doesn't matter that I've worked in the industry. I am not remembering things. I'm not comprehending things. You need to break it down for me like I am in fourth grade, and we need to talk about it that way. And I
Yep.
and then I say, and notice what gets triggered for you today, and then go find a therapist and deal with it. Because when you walk into that room, it's about the patient. It's not about you. It's not
Totally.
about your trauma and the things that you're coming from. It's about that person and their family. Because you're caring, when you care for a kid, you're caring for their entire family.
Yep. I mean, it's sacred work.
Yeah,
I mean, I have the highest respect for the practitioners that commit their
100%.
career in that direction, right?
Yeah,
It's very hard. It's hard and sacred, and that work matters. And it has ramifications a lot more than the transactional nature that most of the industry treats it like, because we
yeah.
just bill the encounter and then go about our day. But
ICF
the
check.
exactly. But how we care for people in those
Yeah,
moments impacts decades of their life.
totally.
And and that's true not just for the patient, but the family surrounding them too.
Yeah,
And just because a patient passes away, and this is something I so care deeply about, like the palliative care and hospice practice too, is that they recognize the family surrounding the patient
mm-hmm.
as a full part of the package. They don't
Yeah,
separate them. And and they do continue services even a year after, a patient passes away, they continue providing services to the family with therapy, child life services, other things like that. They come and provide that for families a year, maybe other, predetermined timelines, but it doesn't end right when the patient passes away, or whenever
If the
those
hospital
services are.
has it.
What?
Like if that's a hospital by hospital thing though, like I think that's the part that I struggle with child life in particular is it is something that every child and family should have access to,
Oh my
and
gosh,
yet those
absolutely.
positions are often funded by donations to a foundation at the hospital. They're not reimbursable, and if some of the activities, like in New York State, you can reimburse some music and arts therapy, but then it means that you only get access to it if you have that on your insurance list, right, of things that they can bill. So these positions that are so critical to preventing trauma or to, like in both of our cases, helping after trauma has occurred, when you're in that after period, helping your children, I would assume, understand the loss of their sibling, they're not they're not guaranteed services for everyone.
Mm-mm.
Yeah,
No, and
which
that,
is wild.
like, oh my gosh, we could probably have a whole episode, I think, on this topic alone when it comes to the art stuff.
I rant
Uh,
on it quite frequently, yes.
yeah. But it is like, and especially, I feel passionate about that role of art in general as a way to preserve human dignity and also provide a metabolic outlet for grief to actually be processed both real time and after the fact. Like these
Totally.
are like human needs that are so fundamental that it's almost striking that we've like othered that practice from the practice of medicine. And it's really remarkable to me. We had a comment from Aaron. Thank you for joining
Oh,
us. And Marcella, thank you for joining us too. Aaron said really important points about designing for dysregulated nervous systems. Haven't heard that framing before, and it makes a ton of sense. Yep.
yeah. Yeah,
Yep.
absolutely. Hi, Erin. I I think when I when I'm looking at innovation, and like everyone right now, it's like AI, 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 right? But when I think about innovation and I think about what are we actually innovating for, and everyone was talking like, oh, it's for the patient experience, but like I don't know that we actually are, right? And I think one of my concerns is that we're getting to a place where we are um, defaulting to models that were trained on incomplete information
Hmm.
as to what we're going to, and I don't know that we have enough. I don't know that we've done patient engagement well enough to automate it. Do you know what I mean? And not that we
Oh,
could ever
totally.
automate it, but like I don't think we have the source documentation in place that is sufficiently comprehensive enough to build even simulations that would get to the truth of the matter. And I feel like that's when we talk about design and we talk about where things are headed. For me, this is something that like keeps me up at night. Is wh- I would love to see the people who I know are so good at these things leading the way on how we're designing the systems, how we're designing any type of agentic flows or whatever that everyone is building it now. So like it's here to stay. We got to figure this out. But I would
Hmm.
love to see it done by people who understand the human side of it, because I my concern right now is that everyone's moving so quickly that we're going to be exacerbating the problems that already exist instead of and making things worse.
Yeah, no, absolutely. I think it's a real concern, especially when you've got practices. I mean, and to no follow patient experience, but like historically, that discipline in general has prioritized HCAP survey scores.
Yeah,
And like, how are we going to make sure that people engage with the survey and fill it out appropriately and give us feedback that's constructive?
totally.
And like that's kind of been the heart of the practice. And really, patient experience is so much more than that. And we haven't been, maybe as a discipline, also given the runway and autonomy and influence to be able to drive the strategy meaningfully the way that we should be
Yeah,
doing.
yeah,
Because it's the way it's been done now is such a small piece of it. And to your point, we've got AI now in the mix influencing that decision making at the enterprise level and at scale.
yeah,
And if we're not making good decisions that are like on the micro level, because we're not having a full picture and context, to your point, it's not going to translate and it's not going to scale the way we need it to.
yeah, yeah. Yeah, I feel like we're at a oh, so I could be so cliche right now. I feel like we're at an inflection point because we're always at an inflection point. We're like the whole planet is. The
Well,
planet's been at
our
an.
whole lives have been an inflection point, to be
I'm
honest.
just I'm inflecting every day. Every day I inflect somewhere. I think that we have this opportunity right now to make things better potentially. The systems that we've long held and like assumed to be steady and stable and true, where only incremental change is possible. Um, which there are definitive benefits to that. Do not misread what I'm saying. But a lot of
Yeah.
those things are kind of up in the air right now. And I just like I would love to think about what does good look like? Like what is the plus side of what could be? I think we're also focused on like what we're losing. And I don't know if you I guess this is I think I'm gonna ask something and I'm gonna know the answer is why are you asking me this? I'm less than a year out. But I think
Oh, I'm all right. I
after
can hang.
okay. I think that after you've gone through the loss of a child and you've had to live with the anticipatory grief that comes with that because like you know as a parent, you know as someone who loves someone where things are going off and even before the labs get there. Like I think there's just you know, you have to accept that there is a life after, right? And so like your whole world fell apart, my whole world fell apart.
Yep.
And everything that we thought was true and knew to be true and that we were clinging to and the futures we thought we had just went away and then the thing that you learn is like there is an after, right? And I find myself and I'm going to ask this question, I feel less concerned about like yes all of these things are changing right now and that is scary and that is whatever, but I would like us all to think about what the after looks like. Does that make sense?
Yeah, I think it does. Because I would echo what you're saying, at least maybe like saying it back a little bit
Yeah.
in my interpretation of it. I was very humbled by that experience. Like it was the most vulnerable
Yeah.
thing I've ever done. And the only comparable moment I can even fathom is childbirth and labor. Like that's like the
Yes.
only thing. That's the closest thing I could possibly come to.
Yeah.
Is you're just completely vulnerable. I mean, I'm thinking of the transition itself, I guess, specifically. But I would say that experience leading up to it and even immediately after was so disorienting, but also recalibrating in some ways. Like it really opened up or cracked open a part of my spirituality, perhaps, that I didn't expect. And I think to that point, like looking at a human life beyond its biological expression, I think is really the heart of what we need to be doing as an industry and not just saying, oh, and I think that's part of like the loop we get stuck in is like we think of bodies as these like mechanical items that we can tweak and adjust and override in some cases. And that reality is that like that's not the case. Like Descartes did us no favors with this like idea that our mind and body and spirit are separate entities. Like they
Yeah.
really are integral to one another. And
Yeah.
you can make a ton of progress isolating those and studying them independently. But you still have to come back and integrate them together on the other side of it. You can't
Yes.
keep them as separate things. Otherwise, you're dehumanizing the machine effectively, right? You're saying, this is a machine, it's not a human being. And we're treating human beings as if they are mechanical items that can be
Yes.
optimized.
Yeah.
And that's not just true of healthcare. Like, that's my, I guess, philosophical insight into all of society when we think about our, experience as professionals and executives too, right? Especially coming from a world where our nervous systems are more nuanced and sensitive than some other people's.
Yeah.
We have this expectation that everything should still be measured on better, faster, cheaper. And like we say things like work smarter, not harder, when in reality, like, okay, how do you even begin to do that in a world of AI to throw that in the mix? And it's like, I just feel like I'm cheating now if that's the case. Like I can work smarter all day. How do I bring what I offer and what is in the first place? Like my spirit, what does that contribute to the problem and solution that I'm trying to solve?
Yeah.
I feel like that was
And
a
like
very like kind of went all over the place.
no, but I had a similar experience where I was
Yeah.
like not at all and then like very became like very more so focused on like what lies beyond the physical
Yeah.
after Rona died. And I think it's part of coping for me, but also like when I think about my ability to interact in the world, driven by it is so driven by what I know to be true as a person. And I think to your point too, and like kind of looping the discussion back, 360, when you are trying to function in the world after you've been through profound trauma or loss, you are likely doing things to try to regulate yourself. And so every
All the
day
time.
I do things that help me be centered and show up as a full human. Um, and you just start to interact with the world differently, and I think you see things differently too. And so for me, like I think the focus on keeping humans front and center in healthcare is so critical. And I think it gets lost. And it's not even just AI, like that's part of it, but like billing codes, that's another part of it,
Mhm.
and like 50 different logins for sites for every study that they run, that's part of it. Because every time you're logging into a system, you're not paying attention to the person sitting in front of you. And I think this is the part that we're getting wrong. And it's the part that's burning people out, frankly.
And I think to add to that, we don't look at rest as a strategic function.
Yes. Yeah.
And rest is so essential. And this is like me like lecturing myself too. I don't rest well. Like when I
Same.
downshift, I'm like in front of a red light panel and on a vibration plate because I'm like, still trying to regulate my nervous system, right? But it is so hard. And I think the connection that I've made too, that I try to rationalize and coach myself on is like I do extreme endurance sports and have had a history of practicing and training for those things. I would never build a training plan without a rest day in my week. Like I just wouldn't. Like I have to have a
Yeah.
rest day for my muscles to actually physically recover from the strain I put them under during the week. And as executives and as parents or, as bereaved parents or whatever that looks like, however we're operating, a lot of the time our weekends are not restful either, right? We're just running all the time. We've got something going on. Whatever doesn't get done in the week gets piled onto the weekend. The weekend then is the close the gap on all the things that didn't get done. And then I can actually run into the next week and focus on work again. And when we don't properly rest, whether that's in the hospital or at home or in between things or in grief, we are ignoring a core human need. And this is back to like the machine expectation. Like we just, as a society, really could learn a lot from rest integration as a strategic lever. And we need to actually honor it. And rest might be play too, in some cases. It might be
Yeah.
playing with toys or coloring a picture or playing a musical instrument or whatever that looks like. But those things are really integral and important, and they're actually central to what it means to be human, not a bonus
Yeah.
like, yay, now you get to go color a picture because you took care of this hard stuff. Like it's not, that's a paternalized structure of how we should organize things and not truly honoring the full human experience.
I feel like I probably need to hear this. I had a moment. I had decided because I've been on the road for essentially May. Like I've just been like going. Like it's everyone plays. My friends call me Carmen San Diego. It's like I'm the friend that's like, "Where are you?" instead of "How are you?" It's just like that is
Yeah.
me. And I came back Saturday, and I was like, I am going to take this long weekend and I'm going to rest because that clearly, and I'm going to ace the rest, right? Like I had my plan. It was like the yoga I was going to do and the things I was going to be like type A rester. It was going to be so great. And then I just like went to check one quick thing on Sunday and like 5 or 6 hours later closed my laptop. It's like, it's one of those things. So, well, how are you going to rest this weekend? What are you doing for rest this weekend?
I am not resting this weekend. I
Oh,
am going to
good.
end our live this morning and then head to the airport myself.
Oh, nice. Great.
Actually heading to ASCO in Chicago
Oh,
uh,
nice.
for the weekend. So it will not be restful, but it will
Okay.
be really, it'll be a great experience all across the board. Um, it'll be heavy in some ways too, though. So, I mean, for me, candidly, ASCO has also got an emotional imprint as well.
Totally.
Last year, um, August, I'm from Chicago originally. I come from the suburbs of Chicago. And for a long time, caring for August, he wasn't able to travel because he was so medically acute. I mean, we just
Mm-hmm.
had a trach and, G-tube and private duty nursing and all these things. And we weren't able to travel. And so we finally, as he got closer to like 5 years old, was stabilized well enough to be able to start to travel. And unfortunately, that's when we got his like final recurrence notification. And they said, you've got, 3 months and go make the most out of it. So we like leaned in hard on the travel now at this point because we were able to do it. So we did our around the world tour, but he continued to do really well. And so last year, the last weekend of May, we decided to go back and I wanted to bring my kids to my hometown and I wanted them to see where I
Mm-hmm.
came from because I live in Texas and it's just so different from where
Yeah.
I come from. And I wanted them to have that context. And at the same time, that weekend just happened to be ASCO and August was pretty well known in the Cancer X community. And it was really wonderful because he thought of himself as a young professional and he would have meetings and his own agenda and schedule. And he wore bow ties to all
Love
sorts of stuff.
that.
It was awesome.
Love that.
And we coordinated with the Moffitt Cancer Center and Cancer X for him to attend one of their receptions at ASCO in
Okay.
Chicago. And so last year, we got to go attend that as a family. We were a special guest, and he got to stand on the podium at the event and took some photos with the leadership. And um, it was just a really special memory and a special moment. And funny enough, it was like actually the last normal night I actually had with him and us as a family together because he passed away 3 weeks later.
Wow.
And then, so it's the last trip he took. It was like the last kind of one of those like core memories of him feeling well because there were like 3 hospital admissions immediately after that. I had to travel for a little bit of work. And then it was just so much all at once after that trip ended. And so this trip was like the last threshold of normalcy that we experienced as a family.
Yeah.
And so I'm expecting a lot of like grief to come up being there and in around the area. And then the same time, right? My body
Mm-hmm.
knows that it was a year ago and this is an anniversary.
Yeah.
But in so many ways too, right? Like that grief is a fuel in a lot of ways too, because I mean, for me, like for me to function, I've figured out somehow a way to take the grief that I've accumulated in my body and emotions and turned it into something constructive. And at least it turns into adrenaline for a little while and helps me do things, right? And so I'm
Yeah.
looking forward to being able to be there, share the story, support, bigger stories that are being had too. And just really like help the industry think differently about how we're doing things and not be discouraged and criticized in that, just redirected because I think we're really close. We just
Yeah.
have focused in some of the wrong areas and made the wrong assumptions.
Yeah.
So
And
all of that answer to say I'm not resting this weekend.
I mean, I'm gonna be thinking of you. Those things can be hard to walk into, and
Yeah.
it's like the double-edged sword, right? Because you're doing so much great work for him, and yet, like I would assume, you miss him every day, and those moments can make those that feel stronger. I wish I'd been able to meet Augie. I wish I had. He sounds like such a trip. He and Rona
Oh
would
my
have
gosh.
gotten along. They're probably getting along
We're
really well
probably
right now,
having a
honestly.
blast. So, like our moms are on LinkedIn Live right now.
Like, look, they found each other. What's up? She was a total fashionista who had like started a YouTube show. That's where Rona's Fun Lab came from. So they're probably like holding court
I have no
somewhere.
doubt that that's happening. He's
Yeah,
like running a board meeting and she's like
totally.
performing and helping with him and oh my
Uh,
gosh.
listen, listen,
I have
and
no doubt.
they're loving it. Well, thank you for sharing him with me. I appreciate it.
Oh my gosh. Well, thank you for sharing your precious girl too. Um, it is hard. And I guess we're almost like at time, which is amazing. And I'm so grateful for like the chance to just chat, right? And we
Same.
get to do this
Yeah,
on a regular basis, which is awesome.
yeah,
Um, so we encourage like anyone viewing too, if you guys have questions or topics that you want to ask, I think, I'll speak for Lindsay and myself. I think really like anything's fair game. Like
yeah,
ask us the questions that you're curious and like really want to know from parents who have navigated this space as caregivers in like a really intense capacity um, and gone through that bereavement experience too. I think there's just such a lesson to be learned from the industry for the industry on what that journey looks like so that we really build in that whole patient journey. in some
Yeah.
form or fashion, right? I think everything's comprehensive. It's not like, oh, here's this little encounter with this health issue that you dealt with, and hopefully it resolves and you go about being a human again.
Yeah.
It's
Yeah.
all
I it's like I would rather people ask. If we were on Twitter, I would like host an AMA, right? Like ask me
totally.
anything about what it's like because I am thinking about it all the time. You're not protecting me by not asking. It's always in the
Yeah.
back of my mind. She's always present.
Yeah.
And I think if I can prevent one other family from having to navigate some of the things that we did, it would be make my grief just a little bit lighter and make things just a little bit lighter. So, 100%. Any topic is on the table.
Yeah, totally agree. Yeah, AUA, ask us anything.
Yeah,
Is
anyway. Sure,
that
why
a
not?
thing? Can we say AUA?
Yes.
I don't think that's as catchy.
That one might require wine though. Like I don't know that that's a coffee chat. It feels like an evening conversation or
Evening,
something like after
like
12 p.m.
after dark,
Eastern. Yeah.
caregiver lives after dark.
Yes. 100%. Yeah.
I love it. And I guess adding to that, right? I mean, like we weren't just caregivers. Like I think the you really like unicorn level that you get, at least chatting with the two of us, is that we're like executives in this space that are trying to change the industry systemically as simultaneously as parents who navigated it too. And
Yeah.
um, that's not always a common thread that folks are able to lend. And so I'm really excited to be able to offer that.
Totally. And then the other thing that I never talk about is like what being the donor meant,
Oh
right?
yeah. Yeah.
I mean, I was a patient multiple times, but I just put it in the back burner, and they'd be like, "Don't lift anything for 48 hours," and so I just used the other arm to carry her around. You know, like
Yeah.
it's one of those things. But that's a perspective too that, and I know you bring your own as well.
Yeah, I was gonna say, I'd say the most comparable to that I would say is I was a breastfeeding mom through his journey with chemo.
Yeah.
And he went from exclusively breastfed to, you know, having some swallowing issues. But that was like my first actual like step into advocacy was I know that this benefits my son beyond just the nutritional benefit.
Yeah.
He's like a psychological comfort that comes from it. And this is when you would need it, is when he's feeling uncomfortable, when he wants to feel close. And so I worked very closely with the speech and feeding team inpatient to get special clearance that, you know, look, if he is an
Mm-hmm.
aspiration risk, we recognize that. But if he were to aspirate on something, breast milk's the best thing for him to aspirate on. And so like I'm getting a little bit in the weeds, but when it comes
Yeah.
to the like kind of my flavor, I suppose, of the donor experience, it's not certainly as clinically intense as yours. But I think when we this comes back to like the family is an extension of the patient. And like you can't isolate the patient from the bigger support community, whether it's, you know, a breast mother or if it's, you know, somebody who's actually clinically contributing to the outcome too. Everybody's still involved and they deserve the same dignity and support and respect in their own human journeys as much as the patient that we've identified and centralized everything around.
Yeah. Caregiver burnout's real. I think,
Gosh.
and not just when kids are involved. I think caregiver burnout for the sandwich generation in general is a very, very real thing that that feels like a good next topic maybe. Uh,
Totally. I think that's a
yeah.
great plan. Well,
Okay.
thank you all so much for joining us. Appreciate everyone that chimed in. Aaron, and I think Marcella joined too. Aaron, so many great comments. Thank you so much for contributing those on here. And I look forward to anyone else who was able to watch this later and offer some reflections of their own too. And we'll reconvene next month. Ironically, I was looking at the calendar and it'll be on August death anniversary.
Do we want to
So
reschedule it maybe? Let's talk offline when we can
we
think
will,
about that.
but maybe not. Maybe it is. Maybe it's like my active bravery that day to do something in honor of him, and then I'll go to rest the rest of the day. I have nothing else scheduled that day, but we'll figure it out. So either stay
Okay.
tuned. We'll either reschedule it or we will have it that day, but we'll let everybody know.
Okay. Okay. Thank you, Erica. Thanks for sharing the space. And I had to close my LinkedIn because it was echoing, so I haven't seen the comments, but I'm going to go back and catch up.
All good.
Thank you all so much for joining.
Yes, thank you.